Welcome to Friday's edition of COVID-19. The daily tally stands above 2,000 for a second day on this Friday here in Korea. Accordingly, efforts to expand public inoculations continue here and elsewhere, with some countries strongly recommending COVID-19 vaccines for expecting mothers. Now, we have more on this later on the program. Here first is the broader pandemic coverage with our Kwon So-ah. Now, So-ah, just start us off then.
Sunny, we are closing off the work week with a concerning figure of 2,052 infections tallied as of 12 a.m. And that's 2,001 domestic transmissions and 51 imported cases. So it is a drop by 100 cases compared to Thursday, but it is a rise compared to last Friday when we were slightly below the 2,000 mark. And with that, Korea has accumulated 232,859 infections with 2,197 COVID-19 related fatalities. And all places around the country are not spared from infections this Friday. Especially concerning are the figures in the capital region as well as in the southeast, especially with a surge here again in the city of Busan.
Right, and against those numbers, of course, authorities have decided to extend social restrictions nationwide for another 2 weeks.
Right, Sonia. So let's take a look at the social distancing levels by region by taking a look at our map again here. So level 4 social distancing measures have been in effect in the capital regions as well as the cities of Daejeon and Busan. Also just recently in the island, Jeju-do Island, while the rest of the nation is generally under level 3, that is, with a few exceptions within those regions. So the extension will be in effect from Monday, August 23rd until September 5th. Basic prevention rules remain the same, but the closing times at restaurants and cafes under level 4 has been changed to 9 p.m. from the earlier 10 p.m. So it may sound harsh for business operators, but on the other hand, when it comes to the 2-person limit past 6 p.m., there has been made an exception to the rule.
Considering the progress in vaccinations, we will allow groups of up to 4 people at restaurants and coffee shops if they include 2 fully vaccinated party members.
So this is part of the government's vaccine incentives that were earlier put on hold due to the sudden surge in infections. Authorities, meanwhile, are hoping the extended measures could prevent a worst-case scenario coming off the summer vacation season, coupled with a fast-spreading Delta variant. A health official noted this Friday there was a slight slowdown in the first week of August, but a nationwide increase since the second week, stressing that until September, current measures must be maintained. Now, while there have been earlier discussions of an extension until the Chuseok holiday, so for a month, officials decided to monitor the situation as the week progresses. Chuseok, meanwhile, is also roughly the date when the government is planning to inoculate 36 million people with at least 1 dose of COVID-19 vaccine. So far, we've got 24.8 million who got vaccinated with at least 1 dose. Meanwhile, late vaccination reservations for those aged 18 to 49 continues this Friday. In specific, here, those aged between 18 to 35 beginning 8 p.m. and then beginning Saturday until September 18th, 6 p.m. This whole entire age group can make their reservations if they haven't yet. Now let's shift over to our neighboring country, Japan, where torch relay events for the Tokyo Paralympics have kicked off on Friday. There are concerns as there has been the first COVID-19 case linked to the Paralympics just reported a day before. Meanwhile, state of emergencies took effect in 7 more prefectures as numbers are rising. The country has surpassed 25,000 daily cases for the first time on Thursday local time. And the total number of infections around the world now stands at 210.8 million with over 752,000 new cases. And those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, so I'll see you back in a bit. Right, now back on the domestic front, over 17 million people between the ages of 18 and 49 have either booked their vaccines or are eligible to do so until the 18th of September. Also, aside from the government-designated doses, individuals above 30 have the option of surplus vaccines, including AstraZeneca shots. For more on this, I have our Chewon Jung here in the studio with me. Welcome, Wonjong.
Hi, Sunny.
Right now, Wonjong, I understand surplus AstraZeneca vaccines have been in high demand among those in their 30s and 40s. Do tell us more.
Right, so last week, the Korean health authorities they lowered the age limit for AstraZeneca vaccine from 50 to 30, and because there's a growing pile of unused AstraZeneca vaccines, and the authorities are trying to prevent these vaccines from being wasted. And that being said, let's take a look at this slide up on the screen right now. And according to health officials on Thursday, and among the more than 12,000 surplus AstraZeneca recipients on Wednesday, around 10,000 people are those in their 30s and 40s. That's more than 85%. Now, due to concerns over recent delays in vaccine shipments, more and more people are turning to surplus shots in hopes of being vaccinated before the Chuseok holiday begins in September. And of course, another factor is the rapid spread of Delta variant across the country right now.
Indeed. Now, Wonjong, just like any other surplus vaccine, those signing up for AstraZeneca can get them right away at any medical center then?
Right, but there are some people who rather wait to get mRNA vaccines because they're still worried about any possible side effects from the AstraZeneca shots. Let's take a listen.
I'm worried about getting the AstraZeneca vaccine after watching the news about adverse reactions such as blood clots. I'd rather wait for my turn and apply for Moderna or Pfizer later.
But one thing that I want to point out here is that the blood clots have been extremely rare among those who got the AstraZeneca vaccine, affecting 3 people out of the 10.6 million recipients. 1 person died and 2 required intensive care. While unfortunate, the benefits of the vaccine still outweigh the risks, according to many experts. One of them, who I spoke to, said he understands that people might have reservation about the AstraZeneca vaccine, but he agreed with the government's decision to lower the age limit, given the worsening COVID-19 situation here in the country.
The policies governing the AstraZeneca vaccine have been confusing, but I believe it's right to make AstraZeneca vaccines available to anyone over 30 who wants to get vaccinated. The risk of contracting COVID-19 is higher than that of severe vaccine reactions, given the rising number of infections.
And the dosing interval is slightly longer for AstraZeneca vaccines at 8 to 12 weeks, according to Korean government guidelines. And this is compared to mRNA vaccines like Pfizer and Moderna, which are currently set at 6 weeks.
Right, and meanwhile, on this Friday, as Suha mentioned, authorities have decided to extend social restrictions nationwide for another 2 weeks. But I understand some health pundits are calling for a shift in strategy.
Right, so as you know, the Greater Seoul area has been under level 4 restrictions for 6 weeks now. And some experts said that we should expand our use of antibiotic treatments to cope with the surge in infections. Let's take a listen.
Our current distancing measures were formulated before the spread of Delta, so they're not as effective. But regarding treatment, the use of homegrown antibody therapeutics can help us lower the rate of serious illness in COVID-19 patients by 70%.
And she added that we may have more options when other homegrown drugs become available in November or December this year. Now, another expert had a different take on this issue, saying that it's time to live with COVID-19 while managing our risks.
We talk a lot about living with COVID-19. In fact, that is exactly what we're doing right now, given the ever-present risk of COVID-19 infection. What we need to do is create an environment where we can still maintain a semblance of our regular social lives while keeping risks to a minimum.
And all of these experts seem to agree that stringent curbs are unsustainable in the long run, and that drugs and therapeutics could help the country better manage the current wave of infections.
I see. All right, Wonjong, as always, thank you very much for the coverage.
Thanks for having me.
Right, and it's time now for the regular afternoon briefing on the COVID-19 situation here in Korea.
I am Kwon Junuk, the head of the National Institute for Infectious Diseases, and let us now begin our regular briefing for August 20th, Friday. First of all, as for the age bracket of 18 to 49, we are opening the reservations, and here are some details. And we have been receiving the vaccination appointments, and depending on their last digit of the birth dates, we have had the 10-day rotation booking system, and we have more than 15.3 million people eligible for the vaccination, and about 9.3 million, or about 61% of the population, have completed their reservation. And as for these age group, we have also some people who are already vaccinated, and also considering these numbers of people, we believe that about 77% of the people in this age bracket are either are ready to get the vaccines or have already got their vaccines. So we would like to thank you for your participation as well. And also, as for this age group going forward, starting from the until the 18th of September, we will be receiving the booking for these age group. And as more specifically, today we are also having the booking available for those aged between the ages of 35 until 35 to 49, and from 8 p.m. today we will also open the late bookings for 18 to 35. And also as for the later dates that begin from Saturday, we will be opening the booking for all of the age group in this age bracket. And also as for inoculation, they will be given out the vaccination starting from the 26th, either Pfizer or Moderna at designated hospitals or also vaccination centers. And also starting from the 26th and 29th of August, they will be receiving Pfizer vaccines regardless of regions. And depending on the supply of the vaccines, starting from the next week of that specific dates, we will be giving out individual notifications of which vaccines they will be given. And also at specific hospitals, we are giving out Moderna vaccines for the age group of 50. So we will need to also think about the further supply of Moderna here in the country, and we will also have to change and shift the type of the vaccines that are given out at these medical facilities in order to effectively minimize the vaccines that are going to be wasted. And moreover, as for those inbound travelers, we are having also an exemption of the quarantine measures, mandatory quarantine measures for these people who have been already fully vaccinated in other countries. However, as for countries where the Delta variant and the Gamma variant is spreading very fast, and moreover, we are exempting these countries from this free isolation period, and we are also going to include Peru as well as other countries which are witnessing a Lambda variant. And to this end, starting from September, we will also have a new list of countries that are under the intensive monitoring and will be exempt from such free quarantine measures. And we have designated 36 countries. So to sum up, we are also right now exempting all of the people who are flying into the country, as well as those who have been vaccinated here in South Korea, as long as they are fully vaccinated. However, if they are coming in from these 36 countries which are witnessing a rampant spread of the new variants, we are not going to be subjecting them under such exemptions. And as for the new variants, we have been cultivating these new variants up to about 874 samples across 66 institutions, and most of the samples were regarding the Delta variant. And as for the therapeutics administration here in South Korea, Rekinora treatment, we have been administering the drug to over 17,000 patients here in South Korea. And the Rekinora treatment, that is, we are also completing the administrative of the treatment to about 15,000 patients here in the country. Last but not least, we have also further messages to the public. globally, we are witnessing an increase in the COVID-19 infections, and even in Iceland and other countries which high rate of COVID-19 vaccination, which has more than 70% of the population being fully vaccinated, we are also seeing another resurgence of the virus fueled by the Delta variant. Moreover, at these very moments in the UK, which is garnering global attention, it has also eased the social distancing measures in early July. However, it has witnessed a rebound in the number of infections lately. Moreover, in the UK, we have also seen that they have been going through an intensified level of burden for the medical response measures due to increase in the COVID-19 infections. And so for here in South Korea, we are focused on the quarantine measures as well as social distancing measures, and it is difficult to spot any country which is returning to pre-pandemic levels. However, we are also fortunate to see that we are seeing a decrease in the number of fatalities as well as critically ill patients. And moreover, we need to, going forward, implement tough quarantine measures and social distancing measures as well. And we believe that until we continue to maintain these measures, we are able to contain the spread of the virus and flatten the curve to a large extent. Currently, our biggest variable at hand is the spread of the Delta variant as well as other strains. And as witnessed before, we need to continue to roll out our vaccines, and we need to also reach herd immunity as soon as possible. We need to stabilize the COVID-19 infection here, and after that, we need to readjust the social distancing measures, and we are at a critical moment in doing that and also returning to pre-pandemic levels and heading to living with COVID-19. And as of yesterday, our 48.3% of our population have received at least one dose, and about 21.6% of our population have been fully vaccinated. We are expecting that the number of those who have been receiving the first dose will be up to about 50% of the population in a very short period of time. And we believe that it is very important for us to contain the virus spread with the COVID-19 infections, with the COVID-19 vaccination, that is. And we ask you to further endure these difficulties and challenges because all of the countries are faced at the same situation.
Right, there was Kwon Junuk with Friday's afternoon briefing, and I have Soa back at the desk with a summary of his address. Right, Soa?
Right, Sunny. Let's begin with some new adjustments regarding people that are entering Korea through airports from abroad. So due to a rising number of variant cases here in the country, and also over concerns of the Lambda variant, which has not been confirmed in Korea yet, the government has decided to add more countries that will be not included in vaccine intensives, mainly the exemption of a 2-week isolation period if you're fully vaccinated. So 36 countries in total will be on that list beginning September, including Peru, which is where the Lambda variant has first been detected. Also, the official mentioned that there's been around 77% of vaccine participation in the age group of people aged 18 to 49, which includes those who have been already inoculated earlier in the year, stressing that the reservation still continues and we will soon have over 50% of the nation's population who received one shot.
I see. All right, so as always, thank you very much for that.
My pleasure.
Resurgences worldwide, fueled by, largely that is, by the Delta variant, have reignited concerns about the safety of those at risk, including pregnant women, whose infections are likely to lead to much complications. For more on this reality, I have Professor Kim Moon-gyu from Yonsei University. It's good to see you again, Professor Kim.
Thank you for having me.
And I also have Dr. Kim Seung-taek from Institute Pasteur Korea. Welcome back, Dr. Kim.
Good afternoon.
Meanwhile, joining the session virtually is Professor Deborah Karasak at the University of California, San Francisco. Pleasure to have you with us, Professor Karasak.
Thank you. It's nice to be here.
Right, Professor Kim, let's begin then with the risks posed by COVID-19 on expecting mothers.
We divide the pregnancy into 3 phases, which is the first trimester, second trimester, third trimester. During the first trimester, mainly it is a pro-inflammatory condition to let the embryo to grow, implantation. And the second trimester, we have a anti-inflammatory phase to let the fetus to grow. And when we reach the third trimester, it changed to a pro-inflammatory phase to let the fetus to deliver. So there's kind of a shift in inflammatory status during the pregnancy. And I would like to mention next about the immune system during the pregnancy. The innate immunity is quite well prepared for pregnancy, for infection, I mean. So cells such as natural killer cells and monocytes are quite activated, so we can fight against pathogens. But in contrast, for adaptive immunity, which is specific to some kind of infectious agents, is relatively suppressed. Since the COVID-19 virus is quite pro-inflammatory, we can think that the risk of infection might be increased during the first trimester and third trimester, theoretically. We don't have exact data yet. And next, I would like to mention 3 things what happens during pregnancy. The first is the hormone. We know that a lot of hormones are needed to maintain pregnancy, such as estrogen and progesterone. And it causes some swelling in the airway, even though the pregnant ladies do not recognize. But if you have inflammation because of COVID-19, it might cause quite trouble. And second thing is the lung function. As the fetus grows from the uterus, it will increase the intra-abdominal pressure, and it might push the diaphragm upper, and usually the lung function is decreased about 5%. But during the normal pregnancy, it doesn't cause any trouble. But if you get COVID-19, it's going to cause a lot of respiratory difficulty. And the third is the oxygen. Because the fetus is growing very fast, the demand for oxygen is increased about 40%. So pregnant woman is easily get into critical conditions. There's a study from USA that the pregnant lady have 5.7 times higher rate to admit to an intensive care unit, and 15 times higher to get ventilator care, and 10 times higher mortality. And another study from 9,000 pregnant ladies who had COVID-19 and more than 300 babies from that ladies, they showed that premature delivery is increased to, premature delivery is about 29%, which is much higher than usual pregnancy, which is about 5 to 18%. And the fetal respiratory distress is common, and fetal mortality is more than 5 times higher. So collectively, COVID-19 infection in pregnancy is risky, both for the mother and for the baby.
Right. And staying with those risks now, Professor Karasak, I believe you conducted a study that shows the risk of preterm birth, as Professor Kim has mentioned, is also alarmingly high. Could you tell us a bit more about your study?
Yes, so as you mentioned, we recently published a study in the journal called Lancet Regional Health Americas that included all the births in California from July of 2020 through January of 2021. So it was 240,000 births. In total, was the whole population. And we were able to look at diagnosis of COVID-19 infection on the birth certificate, and we found that pregnant women who had reported an infection in pregnancy had a 40% increased risk of having a preterm birth. And that means a birth before 37 weeks in pregnancy. So we also found a 60% increased risk of very preterm birth, which are births that are even earlier at 32 weeks in pregnancy. And so babies that are born very preterm especially often have longer hospitalizations, long NICU stays, and can have lingering health effects into infancy and childhood. So it's a very important outcome to be seeing these types of increased risks with COVID infection. We also were able to look at comorbidities, so people who have underlying hypertension, gestational diabetes, or obesity. And we found that the risks were even further increased, so about 2.5 times the risk of a preterm birth with comorbidities and COVID infection. So I think I agree that we have a pretty clear evidence base that COVID infection in pregnancy at this point is very high risk for both mother and child.
Right. And Dr. Kim, given the outbreaks triggered by the Delta variant, do you see this particular strain as posing a greater threat to pregnant women?
Well, as Dr. Kim and the other the panelists said, actually the pregnant women are more just vulnerable to a COVID-19 infection in general. I mean, compared to others, just general population. But I haven't seen any just a particular, the aspect of this Delta variant. I mean, the Delta variant is now to know the spread much better, and then maybe it affect maybe some severity issues as well, but not just regarding some pregnant women so far. So at the moment, there might be some saying about some some doctor may say some severe cases, but so far there has been no just peer review, some public publication so far.
I see. And Professor Kim, can a pregnant woman pass the coronavirus to her fetus? In other words, is vertical transmission possible?
There was a study from Italy, including about 30 cases of COVID pregnancy, and they showed that about 3 babies got vertical transmission. They concluded it is low but possible. But in January 2021, this year, there was a meta-analysis including more than 900 neonates from pregnancy. About 27 neonates got vertical transmission, infection. It's about 3%. And it's what is in the 3rd trimester, but it didn't cause any consequences for the baby. That was good, but the data shows that they don't know about the possible infection happening in the 1st trimester. So we have to wait for the results to come out. And there are more reports from other countries like China, and mostly they are between 2 to 3% of vertical transmission. And well, I would say that is similar rate compared to other pathogens causing congenital infection. And I want to emphasize that most of the teratogenic consequences happens in the 1st trimester, which is the pro-inflammatory phase, as I mentioned. So we have to focus on the 1st trimester infection of COVID-19. We don't know yet. There might be some unnoticed miscarriage because of COVID-19, but some meticulous studies is needed to make a conclusion.
Of course, and speaking about studies, Dr. Kim, clinical trials on the efficacy and safety of COVID-19 vaccines on pregnant women are ongoing, but I understand they're being met with many hurdles. Could you tell us more?
Well, as Dr. Kim said earlier, that pregnant women actually experience many different the fluctuation in terms of the immune response and immunity and then inflammatory status. So for that reason, actually, the pregnant woman is a kind of experience some series of just a complex phenomenon during these pregnancy courses. So it is really just hard to do any the clinical trials on the pregnant woman. And also there was some prior examples. I mean, just some bad examples of the past, not clinical trials, but examples on some pregnant women. There was some case of thalidomide that was actually reported in the 1950s. In the 1950s, the thalidomide was actually used for the pregnant women, especially in the UK and the Australia, and then some Germany, to just ease the morning sickness. And that was pretty effective. But then that effect wasn't actually just demonstrated by some clinical trials in terms of, probably effective, but that in terms of safety. But then the 1960s, the many children born to such a woman actually just had some birth defects. So that was actually some tragedy at the time. So since then, maybe FDA and other some government agencies just impose a very strict guidelines. But maybe almost just to prevent any most of the clinical trials on some pregnant women. But due to that, many actually very important clinical trials actually just prevented, and then there was actually no chance to just demonstrate any certain drugs on the clinic the pregnant woman. So then now things are just changing a little bit, but that's the most the significant the reason that we do not see most more wide spread clinical trials on the pregnant women.
The birth defects you talked about, is it the lack of limbs? Was it the tragic lack of limbs?
I think so, yeah.
Right.
Yeah.
Right. Professor Karasak, the US Centers for Disease Control and Prevention strongly recommends pregnant women get vaccinated for COVID-19. What is the background behind this recommendation?
Yeah, so as you mentioned, the Center for Disease Control in the United States now recommends COVID-19 vaccination for all people 12 years old or older. And that includes people who are pregnant or breastfeeding, or people who are trying to get pregnant or might become pregnant in the future. And so as we've mentioned, while pregnant women were not included in the initial vaccine trials, still many pregnant women have received the vaccines as they've been rolled out in the United States and elsewhere. And the CDC has created a registry and has been monitoring outcomes. And they've recently released reports that have shown no indication of any safety concerns for the pregnant woman or the baby. And so they also recently released in the last week, right before this stronger recommendation, data that showed that there were no increased risk of miscarriage before 20 weeks. And so I think with the growing community spread of Delta, the risks that we're seeing for pregnant women in terms of COVID infection itself, and this more reassuring data that vaccines are in fact safe and effective, it led them to make that recommendation. Also, the American College of Obstetrics and Gynecologists and the Society for Maternal and Fetal Medicine have recommended vaccination in pregnancy. And also, I think it's important to note that there have been no differences noted in side effects for people who are pregnant versus people who are not pregnant in terms of vaccination.
I see. I understand some reports showed that pregnant women, in fact, showed less side effects as compared to those who were not pregnant after vaccination. Is that true, Professor Karasak?
Oh, that's interesting. I haven't heard reports of that. I've heard that there's no differences between, but if that is indeed true, then I think that's another compelling reason for people to be getting the vaccine.
Right. Meanwhile, Professor Kim, what are your thoughts on COVID-19 vaccinations for pregnant women?
Well, most of the Professor Karasak mentioned, but I would like to explain in this way. For vaccination, there are benefits, there are harms. So first of all, I want to review what benefits we have if you do COVID-19 vaccination for pregnant ladies. It's data from CDC USA, and they reviewed with Pfizer, Moderna, and Janssen. Pregnant ladies and recently pregnant ladies have more severe symptoms of COVID-19 compared to non-pregnant women. So that's the reason. One of the reasons we should get vaccinated. And RNA vaccines reduce infections during the pregnancy, and it does make antibodies. So it's kind of have some effects. That's the second reason. And also the third reason I would like to say is the vaccine reduces the stillbirth. So we have this kind of benefits. And next we move to the harm. What kind of harm we might have if we do vaccination. But it's the adverse effects which can happen after vaccination. But from the animal studies and human studies, there was no adverse effects. So that's a good thing. And the second one, and if you say about the miscarriage rate, normally it's about 11%, but after vaccination it's almost similar, 13%, so it doesn't rise. Second, vaccine does not cause COVID-19 infection, and it's not a live vaccine, so you don't have to worry about getting COVID-19 because of the vaccination. And the third thing, it's safe for breastfeeding. It doesn't affect on breastfeeding after delivery. So if you think about the benefit and harms, there's nothing harmful. We just have something beneficial. So I do agree with the vaccination for pregnant ladies. The last thing I want to mention is about the AstraZeneca vaccination. And right now it's not recommended for pregnant ladies, same as older women less than 40 years of age. But clinical study is still going on, so we have to wait for more results to come out.
Right. Dr. Kim, based on studies thus far, can a vaccinated expecting mother pass antibodies to her baby?
Well, there was some couple of just the reports about those kind of things. I mean, the first one is just transferring the antibody to the fetus, and also just transmitting just the antibody through the breast milk. And there's some report. It's not really just not just comprehensive data, but there's a report that the antibody was just found in the umbilical cord blood, which maybe just indicates the now antibody may just transfer to the fetus, and also breast milk, and from the breast milk, there's the antibody was also found. So there's a pretty good chance of just for such antibodies to transmit it to the fetus or baby and then protect them.
Right. And if antibodies can be carried over to the fetus through breast milk, can viruses be transmitted to babies through the breast milk?
Not probably the breast milk, but as far as I know, the mostly is body fluid, especially for including just blood. The virus is not really detected in the mostly the body fluid very well.
I see. Professor Karasak, what authorities there have raised the alarm on the rising number of infections among pregnant women in the US. Now, having said that, what efforts are being made to encourage vaccinations among them?
Yes, so the CDC has released these recommendations, yet they also reported that only about 23% of pregnant people have been vaccinated to date. And of course, pregnant women have concerns about safety. So now I think with these, the release of these recommendations, also the building evidence, the increased recommendations from the professional groups like ACOG and Society for Maternal Fetal Medicine, providers will likely be having increased conversations about vaccination with patients. And in the United States, we also have a lot of issues with equity in terms of communities that have suffered a greater burden of COVID infection, and that those same communities have often lacked access to vaccination. So efforts are really underway to have a local community-based approach to increase uptake, and also policies like paid leave from work can be helpful, as well as mobile vaccination clinics. And then finally, really combating misinformation and getting information about safety out.
Right. Professor, your furry friend is calling for your attention, I think.
I'm sorry about
that's
that.
fine. Professor Kim, then, what are your prospects on COVID-19 vaccination for pregnant women here in the country, in Korea?
Well, actually, we're waiting for the result to come out, and it came from July this year from USA. And RNA vaccine did not cause miscarriage, didn't cause diabetes during pregnancy, did not cause hypertension, and there's no problem with the fetal growth, and there was no premature labor because of the vaccination. So I think Korea is going to make a decision whether we're going to start or not, maybe in the fourth quarter of this year. And I think our government will wait for more reports to come out. And until then, pregnant women have to take care of themselves very good. I mean, because now we are living in a Delta variant situation, and we don't have good study yet, but it might be more dangerous compared to the previous variants.
Right. And meanwhile, Dr. Kim, what can you tell us about treatment options for pregnant women who contract COVID-19?
Well, that's very tough question. I mean, mostly for the pregnant women, one thing I heard in the past is that most safest drug that can be used is only just acetaminophen, like a Tylenol. But others are pretty much just consulted with the doctor before just trying. But then so far, I think most of the some care is just only just supportive care, like some oxygen and then things like that, but no just specific drugs. But I think just considering some other past experience, I think for some other indications, some monoclonal antibodies, some immunoglobulin G was also is actually being used for some pregnant women for other indication. So at least we can think about some monoclonal antibodies now just being used, some in Korea and also in some foreign countries. That can be actually considered, especially for the woman with the some severe COVID-19 with some underlying just the disease or some risk factors.
Right. Professor Karasak, what now are some facts to keep in mind to ensure safe and effective vaccinations for expecting mothers?
Yeah, so I think that with the Delta variant circulating now, we are seeing some rare breakthrough cases among the vaccinated, and we don't yet know what those links might be to adverse birth outcomes. But given that we've seen that vaccines are really still very highly effective against severe infection and hospitalization, we think that that will translate into a protective effect for these birth outcomes that we're seeing. And I would say in the context of high community spread with Delta, it's very important for pregnant women to encourage family members and those around them to also be vaccinated to reduce overall exposure. And other mitigation measures like masks and policies to protect exposure are increasingly important for pregnant women, and especially for pregnant women that might have underlying conditions that would make them more susceptible to the adverse effects of COVID infection in pregnancy.
Right. Professor Karasak, is the timing perhaps of inoculation for expecting mothers also an important factor to consider? Because I believe Israel earlier claimed that vaccinations, COVID-19 vaccinations for expecting mothers should take place after the first trimester, which Professor Kim pointed out was a very important time.
Yeah, so now in the United States, they're encouraging pregnant women to be vaccinated as early as possible in pregnancy or as soon as they can, simply because the risks of COVID infection themselves are so high. So again, thinking about weighing the risks and the benefits, really vaccination at any time in pregnancy is going to be beneficial to prevent against the adverse outcomes of COVID infection.
I see. Meanwhile, back here in the studio, Professor Kim, for the sake of comparison, which vaccines could you tell us about are safe to be administered, that is, when you're pregnant?
Well, as I mentioned, the studies are more focused on the RNA virus, which is Pfizer and Moderna, and they also include Johnson & Johnson. So I think those three vaccines are quite safe. And if I mention one more time about the AstraZeneca, I think UK already had tried those vaccines for pregnant ladies, but now I think they don't recommend it anymore. And they say that every woman less than 40 years of age, they can change to RNA vaccine, I mean. So I would say that in Korea, pregnant ladies should have Pfizer or Moderna.
The mRNA vaccine.
Correct.
Inactivated vaccines, using the viral vector platform, like the flu vaccine, is that safe for pregnant women, Dr. Kim?
I don't know, for the flu vaccine, I know the people use that as a live attenuated vaccine for this coronavirus. Live attenuated vaccine is a one that is being just developed in some countries, but it's not. I have not seen any substantial progress in this platform so far.
I see, not even here in the country then.
No, not yet.
All right then, Dr. Kim, as always, thank you very much for your thoughts. Professor Kim, thank you for being with us today.
Thank you so much.
And Professor Karasek over in the US, thank you very much for your time and your thoughts.
Thank you.
Right, well, that brings us to the end of this edition. Do have a safe weekend and do seek to refrain from unnecessary ventures outdoors. See you on Monday.